Hi, I'm Dr. Marnie Luck. I'm a naturopathic doctor here in Toronto and co-owner of Annex Naturopathic Clinic. A lot of people ask me, why would I go see a naturopathic doctor? What does that look like? What do appointments look like? What can you help me with? At the end of the day, I'm able to assess and figure out what's going on and develop a comprehensive treatment plan that resonates with you. How that differs from seeing your GP is the length of the appointment. My appointment when I first meet a patient is 90 minutes because that gives us enough time to talk about their main concerns, their goals, go over a comprehensive health history, and then also looking at how the other systems in their bodies are functioning so that we can figure out what's going on, why, and what the best game plan to address those issues is. So I always tell my patients, I want to understand you in the context of your life so we can figure out the best way to get you feeling your best. And in terms of the other things that I will often do is we'll do some objective assessments. So I may send people to go get lab work done, or I may do some physical exams, take blood pressure, abdominal exam. I also work with a lot of pelvic health. So more often than not, I'm doing pelvic exams whereby we might be doing a PAP or a swab or a pelvic floor assessment. So I'm able to do a lot of those things that your GP would do, but the treatment is where it differs most. Foundation of treatment is always diet and lifestyle, so looking at those factors that we're able to modify in a way that makes sense for you. And then on top of that, we may add in some targeted support in the form of nutritional supplementation or botanical medicine. So that's using herbs and plant medicine to really get the body moving in the right direction. I always like to be realistic in terms of timeline, like how long is it going to be before you start to see improvement, and cost. What does cost look like in terms of the additional support that you're going to be implementing, as well as any tests that we may be needing to run to figure out what's going on. And typically after that first visit, we have a follow-up in about 3 to 4 weeks to make sure that everything's moving on the right track. And then thereafter, we may space out those appointments according to when we want to see shift happening and then adjust the plan accordingly. So typically I see patients no more than 4 to 6 times a year, and once their concerns are resolved, then it's as needed or as new concerns or goals come up. So naturopathic medicine might have a great place in your life and be an additional tool to really help you feel your best and live your best life.